She had been sick for, I guess, a month straight.
She wouldn't run a fever temperature, and that was the thing when I'd called Dr. Wagner and I said, I know that she's not running a temperature, but every week we're here, and every week it's something different.
The final straw, I think, was when she couldn't even get up, and she didn't want to be held. She didn't. She couldn't because it hurt.
They took a blood test, and the nurse came in, and the nurse, of course, can't say, until the doctor comes in. When I saw the look on her face, I already had that gut feeling something bad is wrong. And sure enough, when the doctor came in and said she has cancer, and that was like, my heart just dropped.
You have a little 18-month-old, especially at that age, you tell your family or your parent or parents that they have cancer, their first fear is that they're going to die.
That was not something I wanted to hear. Anything else would have been fine.
It's always devastating news, and because everything everybody knows about cancer is horrible. Luckily children, especially children with ALL like Allie, have a really good prognosis with early treatment.
When Allie was diagnosed, she had not only the leukemia in her blood and bone marrow, where all patients have it, but she also had leukemia in her spinal fluid as well, which most patients do not have, but we do see. And so that made her a little bit higher risk and made her treatment protocol be a little bit more intensive.
Her roadmap was 2.5 years, so it was definitely a long 2.5, for us.
She had a pretty rough time of it at the beginning, especially. She did have some infection problems.
The first time I took care of Allie as a patient, she comes in and she has this super cute little dark hair. She had like a little hat on because she'd already started her chemotherapy in Fort Worth, and they were stressed about her losing her hair. It's really a traumatic thing for mamas of little girls to when they start losing their hair.
The chemo going in, imagine your body burning inside. That's how it felt for her. I know it did. The things that she went through, and now that she, it's like, wow, how did you do that? A lot of people can't take that pain, and she did.
To get through all the rounds of chemotherapy, and even though at times she was very sick, she was able to fight back and come through, and she kept on playing, but she would always pull through. And
Allie just looks like a different child now. You would never know by looking at her, by watching her, interacting with her, what she's been through.
So she's been 2 years cancer-free.
Now she's a very active 6-year-old. I see her a lot out in the baseball field with her older brother.
I love you so much. I can't get you out of my head. It's just so...
I think one of the biggest benefits for Allie and her family with Children's Miracle Network is that they've provided the place, the outpatient center, and the equipment to allow her to get her chemotherapy here.
Children's Miracle helped us because we could stay home with our family.
With Children's Miracle Network, now we get to keep the kids here for most of the therapy.
Keeping your family here, getting most of the chemo here is definitely important.
And Children's Miracle made that happen.
Allie just is one of you can't think about her without smiling, and she just brings that kind of happiness to everybody she interacts with.
She's been through a lot. Our whole family's been through a lot, but she's a children's miracle.
It's just beautiful to see her in the state she's in now, cancer-free, and going to have the rest of her life to do all the things she was meant to do.
Please support the Children's Miracle Network and help a miracle kid like
me.